Okay, as I was saying, I would go ahead and get the bag. So I have my bag with me. I'm going to make sure that this clamp, well, A, make sure this clamp's moved down. B, I'd make sure this clamp is closed when I spike the bag. I'm going to go ahead and gather the end of this with my hand and make sure it doesn't hit the floor or anything like that. So I have my bag. I'm going to go ahead and spike it. I would then hang it, and then I'm going to go ahead and fill the drip chamber halfway up. I'm going to go ahead and, so this would be hanging up, so I'm just going to place this over here. Sorry. I'm going to go ahead and then I'm going to have this end, and I'm going to go ahead and prime it. So I'd open the roller clamp. So I'm priming all the way till the end. I'm going to close it again. I'm going to set that down here. I'm going to take my alcohol prep pad. Going to prep pad the end of this. Wiping. And then I'm going to go ahead and prep pad her saline lock, so wiping that as well. And then I would connect the hub to her other hub, connecting. So, okay, this is connecting now. And then, so the next thing I'm going to do is I would obviously like input the rate and everything, and then make sure that it's running at the correct rate. Then I'd unclamp this, make sure everything's running, make sure that her saline lock is unclamped. And after that, I would go over the reason why, which, I mean, I've already went over the reason why we're using it. I'd also go over any allergies that she'd had, any side effects that she may have to the normal saline. I'll also explain to her the duration of the therapy. So we're doing 75 milliliters an hour until further notice. And then I'd also come back. Jack, please get out of the camera, please. I'd come back and in about like 30-45 minutes, make sure everything's running correctly, make sure she's not experiencing any like shortness of breath or anything like that. Making sure to check her IV site again for infiltration, any redness, swelling, anything like that. Just basically ensuring that she is getting the fluids correctly and that she's not having any reactions to it, and then how she's tolerating it as well. So I would go ahead and document that as well. So for a report, I would go ahead and explain that she's a 32-year-old female. She came in because she fell. She has a epidural hematoma over her left lobe, and she was intubated. She has an EVD to help monitor her intracranial pressure, and she has an orogastric tube. I went ahead and placed a Foley for her. She tolerated it very well. She's not on any sedation. She's able to withdraw from pain stimulus, but she is unable to speak. She also has a tube feed going at 40 milliliters an hour. Her EVD is open at 15, and it's draining clear pink fluid. She has 75 milliliters an hour running right now through her IV of normal saline, and that's also continuous. She's been having a pretty increased output the last couple of hours. Her blood pressure is 108/56, and her heart rate is 104, and her ICP is 15. We drew some labs on her. Her sodium came back at 155. And then we also we did a UA, which came back as 310 for her serum osmolality, and her specific gravity was 1.005. So we were kind of worried about that because we know she's losing too much fluid. We went ahead and changed her IV fluid to DW5 at 125 milliliters an hour. We're giving her the desmopressin, 2 micrograms every 12 hours through her IV. Making sure that we're doing a daily weight for her. We're checking her sodium and serum osmolality levels every 4 hours. And we're doing a free water flush through her gastric tube, 200 milliliters every 4 hours as well. We're monitoring her CBC and her electrolytes. We're monitoring her INO. So her urine output and specific gravity right now has returned to her baseline. Her glaucoma scale is still between 4 and 6, and her left pupil is 8 millimeters and fixed. Her ICP is increased to 18, and her respiratory rate is erratic right now. Her heart rate is continuing to drop, so we're kind of worried that she's bleeding into her cranial space. We're just basically making sure that we're going to monitor her neurostatus and also monitor for fluid overload or fluid deficit. Just making sure that we're keeping up on the IV fluids and that we're keeping up on all the orders that have been ordered for her so far. So yes, that is about it for her. Also, I'd obviously tell them that she has diabetes insipidus as well, which is causing the fluid, all the fluid problems. So yeah, that's about it. Have a good day.